Hello, I'm Betsy Ross, and welcome to our very first Healthline program. We will present a new Healthline program each month filled with important medical information that will help keep you and your families healthy. Today on Healthline, we'll take a look at two important women's health issues with local medical professional Dr. Kara Shea. We're also going to meet Janet Chambers, a breast cancer survivor, and learn how her cancer journey eventually led her to develop wings. We'll have medical news in our medical minutes, and local doctors will answer your health questions. That's all next on Healthline, presented by the Northern Kentucky Medical Society. Did you know that the leading cause of death for women is heart disease? And did you know that 8 million women currently have osteoporosis? We're going to learn more about how to treat and prevent both of these prevalent women's health issues with my first guest, Dr. Kara Shea. She's from the Internal Medical Associates of Northern Kentucky, and her special interest is women's health. Welcome, Dr. Shea.
Thank you.
We talked about these two issues. First, let's touch on heart disease. We think of it as a man's disease,
Right.
But it's really something that women should worry about. Why?
Well, as you already mentioned, the real key thing to remember is that it is the #1 cause of death for both men and women in this country. So we need to get out of that mindset that it's a man's disease. It is very common in women, especially as women get older, and women need to really understand what are their personal risk factors for heart disease.
We'll talk about that in just a moment, but also osteoporosis. How do we watch that or monitor it? What can we do to kind of keep an eye on that as well?
Well, we're going to talk today about risk factors so women can understand, are they at risk and why are they at risk for osteoporosis, and we'll talk about some behaviors that might prevent or modify the risk of osteoporosis.
So let's first talk a little bit more about heart disease. Who is at risk? Who should really be watching their heart health?
Well, there's a list of risk factors that we're going to talk about today. Family history, which isn't really just any family history. Of course, since it's the #1 cause of death, everyone's going to have someone in their family who died of heart disease. What we really want to focus on is, do you have a significant family history, meaning multiple relatives with heart disease, especially if they died at a relatively young age of heart disease? That would be concerning. For women, as their age goes up, their risk of heart disease goes up, especially after menopause. High blood pressure is a significant contributing factor in heart disease, high cholesterol as well. Diabetes, unfortunately, people who are diabetic have an extremely high risk of dying from heart disease. And being a smoker, unfortunately, is very bad for your arteries everywhere in your body, especially your coronary arteries in your heart. And then we also want to think about people's lifestyle, since that is something they can modify. Diet, exercise, and weight control help affect their risk of heart disease.
We hear about the classic symptoms of a heart attack, the crushing pain, shooting pain up and down the arm. Do women have those kind of symptoms, or are they different?
Well, it can be either. I think still probably the most common scenario is still what we call the classic symptoms of chest pain or angina or heart attack, a heaviness, pressure, maybe a squeezing sensation in the center or left side of the chest. Often that pain or discomfort can move to the left arm, shoulder, the neck, the jaw, maybe even the back. Symptoms associated with that could include shortness of breath with exertion, nausea, sweating, lightheadedness, or dizziness. Outside of those sort of classic symptoms, we do have to pay a little more attention in women that for some unclear reason, women seem to be more prone to have these atypical symptoms of heart disease. So patients and doctors have to really be aware of if a woman says she feels a little nauseated or dizzy with exertion, if she climbs a flight of stairs and just feels a little back discomfort. We have to think that that really could be a sign of heart disease in women.
And of course, as with anything else, don't fool around. Go see a doctor as soon as possible.
Absolutely. Just pay attention to what your body's trying to tell you.
So let's talk about osteoporosis. More than 8 million women, as we mentioned, have some kind of osteoporosis. What exactly is osteoporosis?
Well, we think of it as a thinning of the bone or a loss of the density of the bone. It's a loss of the structural support that strengthens the bone. So the bones in osteoporosis are more fragile, more brittle, therefore more prone to fracture, especially in certain sites of the body like hip, spine, and wrist are more prone to fracture in osteoporosis.
So who is most at risk?
Well, as women get older, their risk continues to go up, especially in elderly women. And it's not just that their bones get worse as they get older, but also that older women are much more likely to fall. And it's usually the fall itself that leads to, especially a hip fracture. Other risk factors being Caucasian. Caucasian women are more likely than African American women to have osteoporosis. Women who are of a thin frame, a thin body build, tend to have more fragile bones. Having a poor calcium and vitamin D intake in your diet increases your risk of osteoporosis. There's some other lifestyle factors such as excessive alcohol intake, smoking, dietary factors, exercise. A lack of exercise can make the bones worse. And it's also important to keep in mind that women who have ever had a fracture have a higher risk of having future fractures.
So you mentioned about diet, calcium intake. Is this something that just older women should worry about having more calcium, or do you start young?
I really like to encourage all of my women patients, even teenagers, young women, I really like to tell them from an early age that they should be paying attention to calcium intake. It really should be a lifelong habit, because if you wait till you're 60 years old to try to start getting more calcium, it may be too late to really see changes in the bones. It really should be a lifelong habit of trying to get adequate calcium and vitamin D in your diet from a young age.
And we talk about, of course, the milk products. That's kind of the classic that we think of calcium, but there are other ways that we can get calcium in our diet.
Right. I try to emphasize to women that there are a lot of choices out there. Ideally, if women could drink a lot of milk or other dairy products, that's a great way to get calcium. For women who can't or don't like to drink milk, you can buy orange juice that has added calcium. Now, it's not just plain orange juice. You have to buy it with the actual fortified calcium they've added to it. Cheese, yogurt is a great source of calcium, cottage cheese, salmon. There are some other surprising things that are not dairy products like sardines and salmon. Certain vegetables have calcium. So there's a lot of other ways you can get calcium in your diet, even if you're not a milk drinker.
What about supplements?
Supplements are a good idea. My feeling on supplements is that I really prefer for my women patients to try to get calcium through their diet. The reason is that it seems that calcium is better absorbed and better digested when it's in a natural dietary form. The problem with getting supplements is that they can sometimes cause some nausea, some bloating, some constipation, some trouble with the gastrointestinal tract when you have it in a tablet form. So if you can get your calcium through your diet, that's really ideal. If you just can't in reality, then better to get it through a supplement than to not get enough at all.
If you have your diet, exercise helps?
Yes, specifically weight-bearing exercise. So that means any kind of exercise that forces you to strengthen your muscles. Weight training, lifting weights, doing weight-type machines against resistance, anything where you're working against resistance to strengthen your muscles. There's sort of a chemical communication in your body where if you're strengthening your muscles, that tells your bones they also need to get stronger to support those muscles.
Dr. Shea, thank you so much for being with us. I think we all learned a lot about just how we can keep heart healthy and bone healthy as well. Thank you very much for talking about these two very important women's issues. Now, for more information, you can log on to the website listed. And we'll be back with Medical Minutes right after this break.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
A great soul ballad is something very special. It's so much more than just a song you sing. It's music that gets deep inside of you. And now you can check out the complete 10-CD Classic Soul Ballads collection for 30 days for just $9.95. Even better, when you use your credit card, you'll get free shipping and handling, a savings of nearly $15. So order now with your credit card, and for just $9.95, bring all 10 CDs, 144 hits into your home. If it isn't the best collection you've ever heard, just send it back and owe nothing more. The Classic Soul Ballad collection is, to say the least, very, very special. And I know you're going to love it as much as I do. I'm Peebo Bryson. Please enjoy the music.
Call 1-800-308-3900 for the classic soul ballads. That's 1-800-308-3900. Call now.
Tune in to the sports page on ICN6. Each week, your host, Don Weber, brings you up to date with the latest in Northern Kentucky sports. From the Florence Freedom to Speedway races, from preseason workouts to the championship game, the sports page will bring you all the action on the field and behind the scenes. This isn't available with satellite. It's only available on the sports page daily on ICN6.
And now our Healthline Medical Minutes. According to a recent news release from Novartis Pharmaceuticals, their treatment for osteoporosis shows encouraging results in preliminary data gathered from the final stage of testing. Reclast, given as an annual 15-minute infusion, appears to prevent spine and hip fractures. It was noted that side effects are generally minor and short-lived. In recent years, drug researchers have been working on developing osteoporosis drugs that can be taken less frequently. Already on the market are pills that are taken monthly and even an injection given every 3 months. Novartis plans to apply for U.S. approval to sell Reclast early next year. Well, now here's a case of good news, bad news. The good news is that Indiana University researchers have found that taking 4 short walks a day may be more effective than 1 long one to lower blood pressure. Time is one of the main reasons most people say they do not exercise. But the researchers compared 4 10-minute walks to 1 40-minute walk and discovered that blood pressure was decreased by the same amount, but the effect after the short walks lasted 11 hours compared to 7 hours after the long walk. And now for the bad news. No more using the excuse, I don't have 40 minutes to walk for exercise, but we all can find 10 minutes several times a day. So let's get off the couch, push back from our desks, and start moving. That's the Medical Minutes for this edition of Healthline. We'll be right back after this break.
I'm Patrick Crowley. I've been covering news and politics in Northern Kentucky for over 2 decades. I'm the political writer for the Kentucky Enquirer and host of On the Record on ICN6. Every week I find out what's going on behind the news from the people making the news. The governor, congressmen, city officials, county officials, controversial figures, business leaders. There's nothing off the record when they're on the record.
Well, I can't walk.
I can walk, but not very far.
I can't even stand anymore. And it gave me no freedom.
If you or a loved one suffer from limited mobility, we have incredible news. Now you may qualify for your very own new Invacare power chair or scooter at little or no cost to you. Call Mobility Products Unlimited right now to begin your free pre-qualification process. Invacare's powered mobility products are comfortable, stylish, easy to maneuver, and go anywhere.
And yes, you can get back out there too with Invacare.
So pick up the phone and call Mobility Products right now, risk-free. Their friendly specialists handle all the paperwork and make it fast and easy to begin the pre-qualification process for your very own Invacare power chair or scooter. You could get yours within just days. There's no pressure, no obligation, no cost for the call. And your satisfaction is guaranteed.
So call 1-800-913-5854 right now. That's 1-800-913-5854. Friendly mobility specialists are standing by.
The Milson Walker Financial Group, full-service financial advisors, can be seen each weekday morning on the chat room on ICN6. Tune in as Robert Walker or Barry Milson talk about the current ups and downs of the stock market, as well as financial news from around the world and what it may mean to you. The stock market reports in Milson Walker Financial Group can be seen Monday through Friday on the chat room, 10:25 a.m. on ICN6.
Welcome back. October is Breast Cancer Awareness Month, and before we meet our next guest, I want to share some important statistics with you. In 2005, 1 of every 7 women in the U.S. developed breast cancer during her lifetime. 70% of women diagnosed have no identifiable risk factor. Every woman is at risk. Now, the good news, it's estimated that 1/3 of the breast cancer deaths in the U.S. yearly could be prevented by early detection. And in the U.S. today, there are more than 2 million breast cancer survivors. I'm now pleased to welcome one of them on today's Healthy Lifestyle segment, Janet Chambers. She is a local breast cancer survivor, and she is the founder of I Have Wings. Thanks for being with us today.
Thank you. My pleasure.
Well, let's start, as they say, at the beginning. When did you find out? When were you diagnosed?
Well, like most women, I was very proactive about my health, and I went to the doctor and got my mammogram when I turned 40. So I was actually diagnosed on my 40th birthday.
So you went through the treatment and all that. How are you doing today?
I'm doing great. I'm doing wonderful.
When you first heard the diagnosis, what was the first thing that went through your mind?
That I could do this all by myself. I didn't want to get anyone upset and have to try to support me every day, so I was going to try to go it alone. And most women do feel that way.
So if you're talking with other women who have been recently diagnosed, what are some of the points of advice that you would give them when they hear that diagnosis?
Well, first and foremost, I tell them to be proactive, get involved in the research and the treatment, get second opinions, and then seek support. Because statistically, women do better if they have the support of group therapy or if they have one-on-one support.
We talked at the beginning about the group I Have Wings, your foundation, that really was born out of this diagnosis. Tell us a little bit about that group.
Well, I saw that there was a need for women who were diagnosed with breast cancer, specifically younger and younger all the time. They take off work and they need some temporary financial assistance, whether it be to supply a wig or a mammogram, or maybe it's prosthesis or prosthetic bra, or maybe it's their heat bills through the winter or kids' clothes for school.
Now, it is I Have Wings, but WINGS is an acronym for something else.
Yes, it is. It stands for With Inspiration, No One Goes Solo.
And the mission of your foundation?
Well, I call it the 3 E's. I like to say that I emotionally and financially inspire breast cancer patients during their cancer journey, and encourage each woman by acting as an advocate for their individual needs, and educate all women, young and old, on the facts and risks of breast cancer.
So how do you educate? What do you do personally to go out and really develop this mission?
Well, I've talked to MOPS groups, mothers of preschoolers. I've talked to luncheons of women. I've talked with high school students. This October is my month to go out and tell people what to do and how to do it as far as breast cancer is concerned.
So what are some of the accomplishments so far with the foundation?
Well, so far we have supplied St. Elizabeth with their phone system for mammogram recovery information, and so we've also support St. Luke and their Turning Points retreat in October 13th, and also St. Elizabeth has a day of celebration in February, and we have our fundraiser, which is the I Have Wings Spring Bling.
What has been the reaction to the women that you have touched through the foundation? What have you heard back from them about really the need for something like this out in the community?
I think the need is great, and educating women and then supporting them financially, emotionally, it's overwhelming.
You talked about the funding for the foundation. You know, it's a good idea to have a foundation, but getting it started, getting the money there to begin with, can be a little difficult. What were some of the ways that you started out just trying to fund this?
Well, I'm just spinning my wheels, basically, having jewelry parties and trying to just provide the funding for these women to have their wigs and their mammograms. That's how I started.
So you go out in the community. Do you hear from these women? Are they frightened? Are they bewildered? Are they confused? Maybe it's a combination of all of that.
It is totally is. And then what happens is I'll call them, and although they've kept it all inside, they end up getting on the phone and asking me a million questions, because it's so nice to hear from someone who's been there and survived it and has moved on with their life.
Is it support that maybe they can't get anywhere else? They need to hear it from someone who's been there, done that?
Pretty well, no, they can get it from support groups, but always the one-on-one is very touching, and I make it a point to get to know as many survivors as I can.
All right, we talked about you're selling the jewelry, but Again, the main fundraising event
I
is
have
coming
Wayne
up.
Springling in May 5th at the beautiful Northern Kentucky Met Center out off Mineola Pike.
All right, we will be looking for that, and of course, that is going to be the main way that you will raise money for this fantastic organization. Thank you so much for being with us, and thank you so much for sharing your very inspirational story. It's nice to meet someone who is an advocate for so many people who have breast cancer and who really need that education. You truly are a healthy hero. Thank you so much for being with us today.
Thank you.
And if you want to learn more about the I Have Wings events, they'll be listed on our Healthline website. And now after this break, we'll have local doctors answering your medical questions in our House Call segment. Stay with us.
For the 20th straight season, ICN6 brings you the Sports Page Scoreboard. Every Friday night, the Sports Page Scoreboard is your place for the first and best highlights of Northern Kentucky high school football action. So tune in every Friday night at 10:54 and 11:35 for the Sports Page Scoreboard. The Sports Page Scoreboard is never available on satellite. It's only available on ICN6.
You're stuck on a treadmill. You're making minimum payments on your credit cards, and you just don't get anywhere. Let Consolidated Credit tell you the truth. When credit card companies are charging high interest, it's virtually impossible to pay off your debt. Let's say you owe $5,000 and your rate is 21%. Of your $100 minimum payment, $87 is interest. It'll take you over 33 years to pay off that debt. Call Consolidated Credit. They'll get the credit card companies to reduce or eliminate your interest. Get off the treadmill. Get on with your life. Call Consolidated Credit. They're the freedom people.
Call now. 1-800-530-5706. 530-5706.
Consolidated Credit. When credit card debt is the problem, they're the solution.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
Welcome back. Our House Call segment gives you, the viewer, an opportunity to ask questions about your own medical concerns. And we have doctors from the Northern Kentucky Medical Society ready to answer your questions. Our first question comes from June in Dry Ridge, and she writes, my 75-year-old brother has a dry cough, and he's always out of breath if he walks from the living room to the kitchen. He spent his whole life working in stables and on farms. I'm worried he has some type of lung disease. What do you think? Here's what Dr. Neil Mosier has to say.
June, the possibility of asthma is definitely present in even someone your age. We see just as many patients at age 15 as we do 45 with newly diagnosed asthma. Many, many times, particularly in the adult, after you've had an infection, either bacterial or viral, we'll see a wheezing or a hyperactive airways for several months thereafter. If this persists lifelong, we will call that asthma. A simple evaluation, a visit with your primary care physician, listening to the lungs, perhaps some breathing tests, perhaps a chest x-ray, will go a long way and help us make a firm diagnosis of whether or not you can be treated for asthma. But certainly, you could have asthma even after a simple bronchitis last winter.
Dr. Ross McHenry answers this question from Jane in Ellesmere. I'm in my mid-30s, and my heartburn has gotten worse over the last 2 years, and I'm eating handfuls of antacids all day long. About a half hour after eating, my chest usually hurts, and sometimes it feels like food gets stuck in my chest. Should I continue using over-the-counter remedies, or should I be seeing a doctor?
Jane, very good question. Very timely topic. What it sounds like you have is gastroesophageal reflux. Big long term, that means things in your stomach, acid or food is coming up into your swallowing tube. You also may be having some of the warning symptoms of gastroesophageal reflux, such as feeling as though food is getting stuck going down. That may represent a narrowing in your esophagus, and I would recommend that you do seek medical attention regarding that, because that can be further evaluated and treated by doing x-rays such as an upper GI x-ray or by an upper GI endoscopy and esophageal dilatation if that is appropriate.
Our final question is from Allison in Covington. As a 32-year-old woman who is trying to get pregnant, I'm concerned that I will have a difficult time being successful. I have a very active and strenuous exercise program, and I follow a strict 1,000-calorie diet. Do you think that I will be able to get pregnant? We went to OBGYN Dr. Adam Crawford for an answer.
Allison, the first thing we need to think about is whether or not you're ovulating. The easiest way to tell if you're ovulating is whether or not you have a monthly period. If you're having a monthly period, likely you're okay. Unfortunately, some people who follow a very strict diet like yourself will not ovulate regularly. This will result in irregular periods and can interfere with your ability to conceive. Simply loosening up your dietary restrictions by maintaining your exercise program might be all that it takes.
And thanks to all of our doctors for their professional medical advice. And if you have a medical question that you'd like answered on an upcoming Healthline program, please be sure to send your question to the email address listed on your screen. Oh, we're out of time on this first edition of Healthline. We would like to thank all of our guests, Dr. Kara Shea, Dr. Neil Mosier, Dr. Ross McHenry, Dr. Adam Crawford, and, of course, Janet Chambers for her inspirational work. Now, if you missed some of the information listed on today's program, be sure to go to the Northern Kentucky Medical Society website and click on the Healthline button. All the program information will be listed there. Each Healthline program, of course, will air numerous times each month, so be sure to check the listings for the days and the times. We hope you will join us again next month for a brand new program where we talk about those medical issues that will help keep you and your family healthy. Goodbye for now. I'm Betsy Ross, and this has been Healthline, presented by the Northern Kentucky Medical Society.